What is palliative care and why does it need to be improved? Current palliative care is sophisticated and can help alleviate many symptoms for those who have a life-limiting illness. Symptoms such as pain, nausea, breathlessness, and even itch are usually well treated when experienced palliative care clinicians are involved. Palliative care does not mean prolonging or shortening life. Good palliative care, in fact, is centred on a patient's goals, so there's no obligation to undergo overburdensome treatments, nor is there an obligation to avoid good pain relief, even if it may have the effect of shortening life a little. In addition to using medications to address distressing symptoms, good palliative care also seeks to address any emotional and existential distress, especially since many symptoms are exacerbated in those individuals who feel anxious, lonely, or disconnected. Adequately resourced, holistic palliative care is very effective at dealing with these other elements which increase physical distress. Sadly, palliative care is not adequately funded in Queensland, meaning that there are many areas, particularly regionally, with virtually no palliative care service. It is likely that there are individuals who suffer great distress in their final weeks of life simply because they do not have access to high-quality palliative care. Voluntary assisted dying is not an adequate solution to this, but in fact represents a failure of our health system to provide palliative care when most needed. Most patients that I have seen faced with a terminal illness will not choose voluntary assisted dying, and they deserve the best palliative care that we can give them. Unfortunately, providing voluntary assisted dying is a cheaper option than palliative care for any government. So it really is important to keep reminding the government of the importance of increasing funding to palliative care services, as well as incorporating the work of charities and private contributions to this sector. Overseas experience has shown us that when voluntary assisted dying is widely available, there is even more need to keep up advocacy for good palliative care services.